Welcome to 25 Women for 2020's Candidate Conversation.
Welcome to another great conversation with two more of our awesome progressive Democratic candidates running for state legislative seats. Today we have with us Cinde Wirth. She's from Columbus, running for House District 59. And we have Shelli Yoder. She's from Bloomington, and she's running for Senate District 40. So we've got some good questions for you. I look forward to some really great conversation with you. But first, I want to give everyone a chance to do a little introduction. So we'll start with you, Cinde. If you could just tell us a little bit about yourself and why you're running. We like to know more about you. And then a little bit about your district, if you like.
Thank you. Good afternoon, everyone. Thank you so much for hosting us today. And thank you all for being here watching. I'm Cinde Wirth. I'm running for Indiana House District 59. That encompasses Bartholomew County, mostly the western portion, which includes Columbus and Taylorsville, and the very southern tip of Edinburgh. I'm a 7th generation resident of Bartholomew County, and I'm a mom, a wife, a business person, a teacher, and a scientist. So I was sent to Washington, D.C. as a science and education expert to work with the U.S. House of Representatives for the 115th and 116th Congresses. I gained experience working collaboratively in a bipartisan manner to accomplish positive policy goals that affect all people. I'll bring those practical experiences to the Indiana State House and utilize them to work on behalf of all Indiana District 59 constituents. And a side note is, I actually wrote and researched an original bill that passed in the U.S. House of Representatives in February. So it's the bill that establishes a monument to women's voting rights, the 19th Amendment, on the National Federal Capitol grounds.
Oh, I bet you're very proud. I would be so proud. That's great. Nice work. So, all right, Shelli, tell us a little bit more about yourself.
Well, thank you, 25 for 20. I appreciate the endorsement, and I appreciate all that you're doing to get women elected to the Indiana State Legislature. I know that there are 3 digits that have really been informing why I'm running and the aggressive, progressive campaign that we've been running, and that is 50, 10, 2. There are 50 state senators, only 10 are Democrats, and only 2 of those are women. And we need representation that better reflects those that they're serving. We decided to run this campaign and be a bold, progressive choice and voice for Monroe County. I've spent the better part of this past decade serving on the Monroe County Council, 2 years as vice president, 2 years as president. And we worked together to advance a progressive agenda. Some of the things that I'm most proud of is the expansion that we did for life sciences at Ivy Tech here in Monroe County. We also made sure that we were retrofitting and having energy efficient buildings throughout the county. And we are really a leader in Indiana in terms of that change that we've had in Monroe County government buildings. We also were really proactive in the way that we set up our youth services and the way that we tend to care for the young people in our community. Progressive change now more than ever is what we need at the State House. I've been a teacher for the last much of my career. I'm teaching at the business, I'm on faculty at the business school at the Kelley School of Business at IU, and teach the next generation how to find what makes them come alive. And as we are going to be recovering from this COVID-19, one of the very important things that a state senator does is constituent services. And that's what I bring to this. It's not only just being a fighter and a strong voice for Monroe County when it comes to advancing a progressive agenda, but also being able to provide constituent services to help make people whole again. So that's why we're running, and that's why I appreciate so much all the people who have come out to support this campaign. And I'm certainly excited to ask for your vote and support on or before June 2nd.
Great. All right. Sounds terrific. Wow. It is so nice to get to know you both. You're both so qualified, and I'm so excited about your being in the state Senate. So, all right, we'll start with some questions, and Shanna's got a question.
Let's talk about it. We are starting this reopening phase in an incremental process. And I'm wondering if you all have experienced what I have recently and what's going on in your districts. I was out yesterday for the first time in months, going away from my home more than a few miles for the first time. and had to run some errands that were very important for our family. My husband and I were out and wearing our masks, and literally no one else was on the couple stops we made. It was stressful. It was concerning. And I'm wondering, is this going on around Indiana? Is there this disparity, and how do we move forward? Shelli, tell me.
Well, I can understand your concern as we begin to start moving around and finding new norms and a new social contract and how we're going to live and move through the post-stay-at-home order. What I see, I know that the mask is uncomfortable. It's both psychologically and physically discomforting. But what we know is it is a selfless act. When you wear those, just the face covering, it is a protection for other people, that we don't inadvertently infect someone else with COVID-19. And so many cases are undetectable. So you could you could have COVID-19 and not know it, and inadvertently infect someone else. And I know better. I know Hoosiers, we stick up for each other. We watch out for our neighbors, and that's not who we are. So there needs to be a strong educational effort on the part of our government leaders, our church leaders, our faith leaders, our business leaders, in talking about setting the example of wearing the mask in order to protect others. It's not a selfish act, it's a selfless act. And we need to do a better job of getting that message out, because there are people, so many of us, definitely we know how this impacts the elderly, the older among us, very differently than it does other populations. It impacts what we are seeing, our brown and Black communities differently, those with autoimmune deficiencies, and those who have immune systems that are compromised in some way. We protect each other. That's who we are as Hoosiers. And it's an easy fix. Wear that mask, practice social distancing when you go out. And as leaders, we need to be talking about it more. Thank you for that question.
That's so important to me, Shelli, to talk about the difference between what can be legislated, a law, and also the social contract that we as concerned citizens for each other can have, a social contract that's based on our moral belief system. That to me is sometimes more important that we do that than just legislating. That the social contract is so important. I think especially here in Indiana, it goes with our Hoosier values. Yes. Thanks, Shelli. And to you, Cinde, what are your experiences? Have you experienced this as well? Have you been out and about? What's going on in District 59?
I have seen that to some extent. I do pickups at stores for shopping instead of going in. And I was checking on one of my sign placements after the windstorm and noticed that there was a stream of cars coming off of I-65 heading toward Brown County, which is, I think, the only state park or it's the largest state park, and I know it's open. And that was, I think, Sunday, Saturday or Sunday. Just a stream of cars from out of town, out of state, going to Brown County. Brown County is not my district, but it comes through. So all those people are coming through, stopping at the gas stations, stopping at restaurants. I didn't see a lot of masks on people at gas stations. When I go to pick up groceries or items through the drive-up services, I see a very few number of people wearing masks out in public. I wear a mask in the car when the person comes to bring me, my things, just because I have to put the window down and to protect them. But what I've seen, which is really good, is the workers are all wearing masks. Unfortunately, I've not always seen them wearing them appropriately. I tend to see them, coming down partway. So I think people are starting to understand when they see workers wearing the masks that it is important. And I think maybe, I'm hoping, slowly we can move toward that area where people understand, as Shelli said, it's not a selfish act, it's a selfless act. I worry about people with compromised immune systems still, because so many people think, well, we've done this for a few weeks and we're tired and let's just be done. And unfortunately, viruses don't work that way.
Thank you for that, Cindy. After I ran my errands yesterday, I came home and we had an issue with our heating and cooling system. And there was a guy that was coming by and he came to the door with no mask on, even though I had already asked him to please wear one. And I had a mask ready for him. He did go to his truck and he put on a big scarf. And then once I was able to talk with him, I explained that I have a daughter who has a compromised immune system due to her disability. And once we had that conversation, he seemed to calm down and things went well and got what needed to be fixed. And I think it's just about having that conversation with people and letting them know why you're feeling this way. So I appreciate that, Cindy. Thank you. And to you, Deb.
Great. So I want to talk more about healthcare. And, we're kind of on this theme of as we move into a recovery phase, what will the new normal look like? And what should it look like? And what can you do to make it look better than it was? And in terms of access to healthcare, we know forever that people didn't reach out for healthcare services because they feared the financial impact on their viability, frankly. I don't want to start talking about all the bankruptcies and everything else, but people did not seek out healthcare when they should have. And during this COVID-19 crisis, this became magnified and of course, much more dangerous because now people were not reaching out for healthcare for a condition that is highly transmissible. So as we move out of this crisis, as we start to put together the pieces, tell me what you think you can do and what our state can and should and hopefully will do to improve access to healthcare and really solve this problem that's just gotten worse and worse. So we'll start with you, Cindy.
Thank you, Deb. That's a question that is near and dear to my heart. I've watched a lot of people I know with their health care that was tied to their employment lose their health care or have to face large COBRA payments over the course of the last few weeks. They're making choices whether they're going to pay for continuation of health care over food or utilities or any other kind of necessities they need, rent, mortgage payment, things like that. It's unfortunate that our healthcare is almost completely tied to our employment. That really needs to end. We need to find a better way. We need to ask better questions to design something that serves all people. And the other piece of that that's particularly disheartening is that when people aren't seeking care, it's often for a variety of reasons, not just financial. There are many LGBTQ plus people who are maybe delaying seeking care because of fears of inadequate care or fears of prejudice coming into the healthcare arena. And I think those are pieces that we need to really pay close attention to when we're designing a new healthcare system for Indiana, which I think we absolutely need.
Great. So Shelli, can you speak on that same issue?
I first want to just say that as a state senator, I would be joining with Senator Jean Breaux in her call for a study on the racial disparities in our healthcare today. In Indiana, she has been pushing this and talking about this, and it just continues to be kicked down the road that can. And I would be joining with her to make sure we are past due for that. What the COVID-19 pandemic has created is we can see once again those fissures in our society of where there are differences and inequities in the quality of healthcare and in outcomes among Black and Brown communities. So we need to be doing all that we can. And one of the things we need information. So I know that originally they said we were not going to have a summer study session on racial disparities, but that is now, she is just a fighter. She just continues to come back at it, and I support her in that. We absolutely need to. I don't think that the decision has been made yet because I think they were reconsidering it. And I hope that I call on Governor Holcomb to move forward with this. We need to know what those disparities are so we can respond effectively and appropriately. We are past due. This is not a result of COVID-19. These disparities have been there all along in healthcare, in education, in the economy, and we need to know what we're working with, especially in healthcare right now. So I support her efforts, and I will join her in that in the state Senate. But I think we should make sure that we are doing all that we can to piggyback off of what Cindy was saying regarding single payer, or taking that burden off of employers of paying for healthcare benefits, but making sure that we're doing all that we can in expanding access to Medicaid here in the state of Indiana. When we need to be doing more there. When it comes to COVID-19 testing and future pandemics, because we know this should teach us a lesson that this is not going to be the only time, and we should not be always reacting, but being proactive in a plan. But we should have testing available, and it should be free to Hoosiers. I support that. And any type of care, there should be equitable access to every Hoosier who needs care around this COVID-19 pandemic.
That's great. And, you know, just one example, it reminded me when you talked about a summer study committee that, you know, we have this horrific maternal mortality rate in Indiana, and of course, triple it if you're African American. And one piece of legislation proposed was to help pregnant mothers in the workplace not be overworked and maybe reduce our infant mortality rate and our maternal mortality rate by protecting pregnant women at work. And that got relegated to a summer study committee, which then got dropped. So this is why we need you women in the state legislature. There just could not be a more glaring example of tone deafness in the current representation there. So, all right, I'm going to send it back to Shannon. She's got another question.
The next topic we've kind of touched on, I want to go deeper because we just don't talk about this enough, and that's mental health care. This COVID crisis, as you've all talked about, has created this perfect storm. You had these racial tensions going on, LGBTQ rights were being challenged already. And then under this COVID crisis, you sent people home, kids are at home, teachers are trying to teach through forums like this, parents are trying to be teachers at home. And then we're seeing the racial tensions explode and the intersectionality of all that. And we also know for sure now that there is this huge connection between our physical health and our mental health, yet we don't have the access and the ability to get the mental health care we need, let alone the stigma of saying, I need mental health care. Shelli, is there anything you could do as a legislator to help people understand that connection and then thereby getting them more help to do so?
Well, I'm in particularly proud of the work that we did on the county council in terms of getting people treatment when it comes to substance misuse and substance use disorders, and not seeing it as a criminal offense, but making sure that people have access. You know, what we were able to do in responding to the opioid epidemic in 2017 really set a trend and got us on the right path, not just for Monroe County, but also central Indiana. And we brought people together, we had maximum capacity at the convention center pre-COVID-19 days. Back in 2017, almost 700 people showed up, and we were able to say, what does our community need? How do we respond? What types of harm reduction can we quickly put in place? You know, we were a leader in the syringe programs that we have, and we can learn by that. And it really wasn't rocket science, but we looked directly to science. Evidence-based practices informed what we were able to do at the county level, and being able to curb those numbers when it came to opioid misuse. And I say that because when it comes to mental health, we can look at science. We can look at what do the numbers show us. Making those investments in mental wellness does make a difference. And so someone should be treated as a whole person and not just broken up and compartmentalized like we're a little partly physical health and partly mental health. It's just health. And we should be treating the whole person. And we can address that in the state legislature and make sure that those types of benefits are included for people.
Thanks, Shelli, especially for touching on something that I believe all of our families have experienced in one way or another, and that is the disease of addiction, and taking away that stigma and knowing that it is a disease process and you can treat it through science for what it is, and that's how you get results. Cindy, speaking on that, I know from getting to know you better that you base everything on data and science. So I'd like to hear your take on this.
So it's really important to remember, as Shelli kind of said, that COVID-19 hasn't raised any new economic, healthcare, or other issues. It's only raised awareness of the disparities that we are already seeing. Inequity in pay, inequity in worker protections, the devaluation of labor, especially in the care-based professions. And those are overwhelmingly filled by women and minorities. This does lead to a lot of stress. These are also our frontline workers who are most at risk of contracting COVID-19. So mental health care access is really important for especially those people, because when you're dealing with the stress every day of taking care of people and putting your life at risk and putting your life on the line for doing a pretty minimally paid job and one that's not well respected, that takes a mental toll as well. So I love Shelli's putting forth that we need to concentrate on the whole person, and mental health care is just an aspect of that whole person. We need a better plan in Indiana to address healthcare overall, especially mental health care. It is something that is still plagued by stigma. If we support mental health care as a part of a whole care package, a comprehensive health care package, that will help break that stigma for all persons. And those affected are mostly women, LGBTQ, and minorities. Again, we're seeing that the people that we deem the most critical for our lives to go on, especially during this pandemic, are those people that are in food, healthcare, childcare, elder care, the cleaning professions, and transportation. And they're the lowest paid and given the least agency and respect in their roles. So it's, I don't have a lot of science to throw at you here, but it's the social scientist in me is coming out. This is the anthropologist looking at that whole big picture. And you can't address that without looking at the whole big picture.
And I'd like to interject something to what Cindy was saying. And maybe you added this and I missed it, but the majority of those in those professions are women. Mm-hmm. And what I've read is when we're talking about recovery, let's not do this on the back of women, on the backs of women, because much of the weight of this pandemic has actually been on women. So I think the way that we respond when it comes to healthcare, mental wellness, just holistic wellness, we need to be really considering that the science of this has preferred more of the male voice. And so we need strong female fighters fighting for us in the Indiana legislature.
And I read, to continue that, because it's so important. I read the other day that we keep talking about the economy stopping and the economy shutting down, except for it's not the entire economy shutting down, because food preparation continues, healthcare work continues, elder care work continues, home caregiving continues. All of those things that are critical, that are sometimes non-paid positions, continue to go on, and that is our economy. It's not just the guys sitting crunching the numbers in the big box stores. It is everything, and we do need to consider all of those as part of our economy. It's often called the hidden economy. And so our economy has not stopped, and it is important to remember that. So I love that Shelli said we shouldn't do this on the backs of women, because we are keeping things running, whether at home or out in the workplace right now.
Well said. And Cindy, I love the fact that you use the term the hidden economy, and the irony is not lost on me that those that are functioning in the hidden economy are most often women and then people of color. And I look forward to both of you being a legislator, two women that can use your compassion and also based in science and data to make these decisions. Those two can exist together to make the best decisions for us all. And to you, Deb?
Great. So I think that's really it for, and we're getting in 25 minutes. So good. So I want to just spend the last few moments, unless you've got other burning things you'd like to say. Absolutely, feel free to pipe in. But I do want you to talk about your campaigns again in this crazy times that we're in. Hopefully, maybe by fall we'll be able to wear masks and knock on doors and talk to people face to face. But for now, no spaghetti dinners, no pancake breakfasts, no political events. It's tough. And I know that you want to hear from voters. You want to talk to them so you can hear from them. So tell me what you're doing in your campaigns to try to reach voters, and then tell us where we can find you on, where we can find your campaign, how we can sign up, how we can help, whether we're in your district or not. Tell us what we can do. So Cindy, we'll start with you.
Thanks, Deb. So campaign is still going. It's mostly digital, mostly virtual. We are reaching out to voters and talking to them, and we have some pieces that we're sending to them personally. At the moment, though, when COVID-19 started, we did suspend all of our formal fundraising efforts because in Bartholomew County, we have a high rate of food insecurity. And so many people are operating on, insufficiencies. And I decided that with a digital plan, since we have no contact, we would be able to find ways to do that, leveraging personal contacts, so that funds could be redirected toward our local food banks or local charities, United Way, instead of to my personal campaign. I feel strongly about that. I have felt strongly about that since the beginning. It is working well right now. I've had a lot of people step up and decide to help. That being said, I'm not turning anything down or returning donations that come in, and I still have people who have the ability to give to both. But I do ask that, if people are going to give, that they give first to those food banks, and mostly through the United Way. I think they're a great umbrella by which we can function. So I'm getting ready to have an event called 5K Your Way for Memorial Day. And that will be a time where you can, people can go out and they can run, bike, swim, paddle, yoga, their way, whatever their 5K worth of activity, or they can sit in their chair and pump their feet and take a picture and show everybody what your 5K work looks like for Memorial Day, because I think we're still needing those connections. We're still needing that fun. It's really difficult to advocate people getting out and doing anything, but responsibly, wear your mask. And we'll be launching that, I think, this afternoon or tomorrow. So I'm really excited about that. And then at the end, we ask that people, again, make a donation to the charity of their choice. And that's, again, that part of that Your Way. So we'll be doing that. They can find me on Facebook for Cindy for Indiana District 59 State Representative, or cindyforindiana.com, which is CINDE, the number 4, Indiana.com. So they can reach me by email or through Facebook Messenger, and if they have any questions. But Memorial Day, 5K Your Way for Memorial Day.
That's great. And so it's really nice too to provide that public service of bringing people together, because it is so hard. And if you can do one more event where you're bringing people together and maintaining those connections, because people need to, they need to interact. So, all right, Shelli, tell us about your campaign. Tell us how you're doing it, and what we can do to help you.
Well, I am so excited that we are, as the state of Indiana is moving, I'm going to continue to press on with this, but we should be moving entirely to a mail-in state. This voting in person, we have been working hard to educate people to apply for their absentee ballot. They have until the 21st, and today is the 19th. So today, if you haven't done it yet, apply for that absentee ballot. You can get that in today. In Monroe County, we made the decision to send an absentee ballot to every registered voter. So you should have it. Make sure you fill it out and get it in by, I would say, mail it in right now. Mail it in today or tomorrow. Because we want to keep you and your family safe. But what I am seeing is when people have an opportunity to vote by mail, they appreciate the time to sit down with the ballot and look at who the people are, what do they stand for. In this case, if there are ever, not here in Monroe County, but if there are referendums on the ballot, people can do their homework. This helps with voter education. It helps with civic engagement and getting more people involved in the democratic process. So I'm a big proponent of the mail-in process because it will increase participation. It will be difficult this time because it's so new, but Hoosiers, we want to be informed. And I know that as people have an experience of doing mail-in ballots, that they will like it, and we will continue to press that forward in the next legislative session. This campaign, because it's so unique with COVID-19, you can get involved and help us make calls to those who have not yet either turned in their absentee ballot or yet voted. We can use you. It doesn't matter where you are in the state of Indiana. If you are excited about sending me and what we stand for in this progressive campaign, you can go to shelliyoder.com and press get involved and get involved. And we can make sure that you have it so easy. And believe it or not, it's fun. We're now using texting platforms and calling people, because you're right, it's not safe to go door to door and to have that voter to voter in-person contact. But we're a scrappy bunch, and we can find new ways of reaching out and hearing and listening to our residents throughout Monroe County or wherever you are in the state of Indiana. But we need your involvement, and we need you to hook up with us on Facebook. You can follow along, Shelli Yoder. You can also find us on Instagram and Twitter. But in terms of what this campaign stands for, this is not very many times do we have a chance to really change the makeup of the state legislature. And our current state senator has decided to retire, and Mark Stoops has served us well. But we have an opportunity to increase those numbers of having a strong progressive voice there, and a woman. So I encourage you to check us out at shelliyoder.com, get involved with the campaign, and vote on or before June 2nd.
All right, excellent. And I couldn't agree with you more about the vote by mail. That was one of the things that it was such a great benefit that nobody really mentioned until you actually sat there and you said, oh, I don't recognize that name. I can go look that person up and find out about them. I as many times as I have voted, I always go into the voting booth and you're looking at, I've never heard of that person. So there's always somebody. So it's really great. I think it's one of the great benefits of voting at home. And of course it's safe. So go to indianavoters.com to apply for your absentee ballot. And you have to do it before midnight Eastern time on Thursday, 2 days from now. So keep that in mind, get on there and do that. And then your absentee ballot, Shelli says, great, fill it out right now, send it back in. But you do have until it has to be in the hands of the courthouse by noon on June 2nd. So mail it early, mail it much earlier than that. But you still have some time once you get your absentee ballot to do all the research you want to do. So, all right, I think that's it for me. Shannon, do you have some closing remarks for us?
Certainly. So action alert, the time is now. These two women have a primary in just a matter of days. And with your help, we can get them through the primary, into the general, and then into the state house. How do we do that? Like they said, go to their websites, go to their social media, inbox them, ask how you can get involved. Phone making those phone calls is an easy way to do it. In a half an hour, you can reach 12 people. And once you get addicted like I do, you start calling some more. In an hour, you can reach over 25 people. That'll make a huge difference in these campaigns. Whether you live in their district or not, You can make those phone calls. You can get involved in texting campaigns just by going to their social media, liking what they put up there, sharing it, commenting it. That'll help to get these important messages out that you saw today. These women have to be elected to our state house, along with our whole team from 25 Women for 2020. You can do that by going to our website, 25womenfor2020.org, inbox us, check out all of our candidates. We have a whole team. We have a statewide approach to send Cinde and Shelli to our state house, along with the whole team, where they can make that difference, because together they are better, they are stronger. So please inbox us. We'll let you know how to get involved in these campaigns. And also, if you have the means, consider a donation to Cinde or Shelli's campaign. If you can do so, donate to Cinde's great event that she has coming up. And then consider a donation to 20 Women for 2020. By doing that, we can affect all the campaigns by doing more of these events and doing other things that'll have our whole team elected. And then you'll see the change that we all want to see in Indiana. Thank you to Cinde, and thank you to Shelli. Thank you to everyone else that showed up today. Deb?
All right, I think that's it for us. So thank you so much for all of your wisdom, and I am sure that we're going to have you both on very soon again, so we can continue our conversation. We'll also have other candidates, other of our 25 Women for 2020 candidates on, so you can get to know all of us. So, all right, that's it. So long, everybody.
Thank
good?
you.
Thank you so much.
Be well.